Hi, Dr. Parker here. Today I wanted to talk to you guys a little bit about eczema. So eczema is something that I see all the time, but what exactly is it? So eczema, or atopic dermatitis, is a skin condition that frequently starts in infancy, and it's characterized by these dry, thickened, kind of flaky patches of skin, and a lot of times you'll find them on the insides of the elbows, behind the knees, but it can occur in all kinds of places. Now, what causes eczema? So we don't have a really great understanding of what causes eczema. There's a few things that we think contribute to it, like family history. We know that genetics definitely plays a role. And then it may be sometimes related to allergies, and it may also be related to disruption of the skin barrier, and that can trigger inflammation. But there are a lot of other potential contributing factors. So how do we treat eczema? Now, you can treat it at home pretty effectively with things like Vaseline, Aquaphor, really good moisturizers. I recommend steering clear of the watery, like liquidy lotions, and going more towards things that are thicker, greasier, that tends to work a little bit better. And if it is a little bit more severe and you're not really getting results with just those kinds of things, you can also use a topical steroid, something like hydrocortisone. And if you're doing that, I recommend using the soak and seal method. So for instance, you have your baby just took a bath and you pat them dry, but before their skin is completely dry, you apply the medication, and then you apply the Aquaphor, Vaseline, whatever moisturizer you're using on top of that, and then you get them dressed. And that really helps soak in all of that moisture, and that helps alleviate the symptoms of eczema. And it is something that we want to keep an eye on and really try to keep on top of it, because that eczema can be very itchy. It's very uncomfortable for them. And if they're scratching at it a lot, occasionally it can get infected. And so it's something that we definitely want to stay on top of. So if you think that your kid has eczema and the stuff that you're doing at home isn't working, just bring them in and talk to your provider about it. Well, thanks for tuning in, and we'll see you next time.